War is usually defined by destruction, yet behind every act of violence lies another story, the struggle to repair what has been broken. During the First World War, this struggle became one of the most remarkable medical revolutions in history. The Great War was not only a conflict of trenches and artillery, it was a laboratory of necessity where doctors, nurses, stretcher-bearers, ambulance drivers, and volunteers confronted injuries on a scale no era had ever seen. Out of this immense suffering came groundbreaking innovations, new surgical methods, blood transfusions, plastic surgery, antiseptics, ambulances, triage systems, prosthetics, psychiatry, and public health reforms. The war maimed, but it also forced humanity to rethink how to save lives. This is the story of medicine's transformation under fire, how the desire to heal became its own form of courage, its own kind of resistance, and its own battlefield. When the war started in 1914, European medicine was stepping into the modern age, but many assumptions remained outdated. Surgeons still debated infection control. Antibiotics did not exist. Blood transfusions were experimental. Plastic surgery was rare. X-ray machines were young technology. Prosthetics were basic. Psychological trauma was poorly understood. Military planners expected a short war with limited casualties, a miscalculation that left medical services unprepared for the coming storm. Within weeks, the scale of injury overwhelmed old systems. Doctors who had trained in peacetime hospitals suddenly faced thousands of wounded arriving in waves. The war quickly exposed how unprepared medicine was for industrialized violence. The medical response had to change, not gradually, but immediately. To understand medicine in WWI, one must follow the path a wounded soldier took from battlefield to recovery, or death. This chain, refined throughout the war, became the backbone of modern emergency medicine. 1. No man's land. It began where the injury occurred, in mud, smoke, wire, and terror. Soldiers were wounded by bullets, shells, shrapnel, grenades, bayonets, gas, and collapsing trenches. Many injuries were fatal instantly. Others required immediate attention from comrades. Field dressings carried in pockets became the first line of defense. A soldier's survival often depended on a friend's steady hands. 2. Stretcher bearers. Stretcher bearers were the unsung heroes of the war. They crawled through fire, mud, and darkness to reach wounded men. They carried bodies heavy with equipment, through terrain that resisted every step. Their work demanded strength, calm, intuition, and extreme bravery. Many stretcher-bearers died before reaching the first medical station, 3rd Regimental Aid Posts. The first formal stop for the wounded was the Regimental Aid Post, often located in dugouts or cellars near the front. Here, medics and doctors performed quick stabilization, stopping bleeding, splinting fractures, dressing wounds, administering morphine, preventing shock. Space was cramped. Light was poor. Shells shook the walls. Yet these posts were the difference between life and death. 4. Dressing stations and field hospitals. Ambulances, horse-drawn or early motor vehicles, transported the wounded further back. Here, more thorough treatment began. Amputations, removal of shrapnel debridement, wound irrigation, emergency surgeries. These hospitals were often tents, barns, schools, or churches converted into surgical centers. Doctors worked from sunrise to exhaustion, their boots sticking to floors wet with blood and disinfectant. Hospitals. Farther from the front, base hospitals provided longer-term care and recovery. Patients who stabilized here had a strong chance of surviving. This chain of survival became a model for future emergency medical systems worldwide. The war confronted medicine with its greatest enemy: infection. 1. Bacteria thrive in mud and metal. The trenches were filled with rotting corpses, animal waste, stagnant water, uncleaned wounds, polluted soil. Shrapnel and bullets carried dirt deep into tissues. Infection spread rapidly: gas gangrene, tetanus, blood poisoning. 2. Antiseptics revolutionized care. Antiseptic techniques became essential: carbolic acid, chlorine solutions, iodine, hydrogen peroxide. Dakin's solution, a breakthrough in preventing gangrene. Doctors cleaned wounds aggressively, removing dead tissue to prevent infection. This practice, known as debridement, saved countless lives. 3. Tetanus vaccination. The war accelerated widespread use of tetanus antitoxin, dramatically reducing deaths from infected wounds. The fight against infection transformed surgery into a disciplined, systematic science. Before the war, blood transfusions were rare and dangerous, but battlefield injuries demanded rapid replacement of lost blood. 1. The development of safe transfusions. Scientists had recently confirmed blood types, allowing compatible transfusions. Surgeons developed methods to prevent clotting and store blood temporarily. 2. Blood banks are born. In 1917, the first true blood banks emerged. Citrate was added to blood to prevent clotting, allowing it to be stored and transported. This innovation saved thousands and laid the foundation for modern transfusion medicine. UI surgeons became pioneers in trauma medicine. 1. New techniques. Surgeons learned to repair shattered bones, treat abdominal wounds, manage severe head injuries, remove deeply embedded shrapnel. The scale of injury forced innovation at unprecedented speed. 2. Amputations, tragedy, and necessity. Before antibiotics, infections spread rapidly. Amputation often became the only option to save a life. Surgeons performed these operations swiftly, sometimes dozens per day. Though devastating, these procedures saved thousands who would otherwise have died. 3. X-rays become essential. X-ray machines became crucial tools for locating bullets and shrapnel. Mobile X-ray units, some operated by pioneers like Marie Curie, traveled close to the front, transforming battlefield diagnostics. WWI created a new category of wounded: men with severe facial injuries caused by explosions, shrapnel, and machine gun fire. These injuries, though survivable, left soldiers unrecognizable and often socially isolated. 1. Harold Gillies and the New Art of Surgery. British surgeon Harold Gillies pioneered modern plastic surgery. Skin grafts, facial reconstruction, jaw repairs, nasal reconstruction, creation of new techniques using pedicle tubes. Gillies and others turned disfigurement into treatable medical conditions, restoring not only faces but identities. 2. The Tin Noses Shop, special workshops created prosthetic masks, painted to match skin tones and expressions. These masks gave soldiers the courage to return to public life. The war forced society to confront what it meant to look human, and expanded the meaning of healing. Amputations created another revolution: modern prosthetics. 1. New materials and designs. Improved prosthetics included lightweight metals, articulated joints, leather harnesses, adjustable sockets. Engineers and doctors collaborated to build limbs that allowed men to work again. 2. Rehabilitation centers. Training centers taught amputees how to walk right, ready machines, return to society. These centers represented an early form of modern physical therapy. Prosthetics became symbols not only of survival, but of resilience. Nurses became the heart of the medical war effort. 1. Tireless work. They cleaned wounds, administered medicines, fed the wounded, recorded temperatures, provided comfort. Wrote letters for men who could not hold pens. They worked in cold, mud, exhaustion, and fear, yet continued without pause. 2. Professionalization of nursing. The war accelerated the transformation of nursing into a respected profession based on training, expertise, and leadership. Women's roles in medicine expanded permanently. Transportation was as critical as surgery. 1. Ambulance systems evolve. Motorized ambulances replaced horse-drawn wagons where possible, drastically reducing evacuation times. Volunteer organizations, including many women drivers, filled gaps with remarkable efficiency. 2. Triage systems develop. Doctors learned to classify the wounded rapidly, those needing immediate surgery, those who could wait, those beyond saving. Triage, once informal, became a cornerstone of emergency medicine. The war introduced the world to the scale of psychological injury. 1. Shell shock symptoms included trembling paralysis without physical cause, nightmares, memory loss, emotional numbness, sudden panic. At first misunderstood as cowardice, shell shock eventually became recognized as a genuine medical condition. 2. Early psychiatric treatment. Doctors experimented with rest counseling, isolation from frontline noise, simple tasks to restore routine. These early treatments paved the way for modern PTSD research. Disease often killed more soldiers than bullets. 1. Hygiene campaigns. Armies launched unprecedented sanitation efforts, delousing stations, regular bathing water purification, disinfection units, mosquito control. These measures dramatically reduced disease deaths. 2. The Spanish flu. In 1918, a global influenza pandemic swept through armies and civilian populations, killing millions. Medical teams fought desperately to contain it, marking one of the greatest public health emergencies in history. The end of the war did not end the medical revolution. 1. Hospitals reformed surgical wards, emergency care units, and rehabilitation centers adopted wartime practices permanently. 2. Medical professions expanded. Nursing, surgery, psychiatry, prosthetics, radiology, and public health all advanced dramatically. 3. Ethical shifts. Society gained a deeper awareness of disability trauma, rehabilitation, long-term care. The concept of veterans' health care emerged, rooted in wartime lessons. 4. The human legacy millions lived because medicine adapted. Millions more found ways to rebuild their bodies and lives because healthcare changed forever. The First World War is remembered for its devastation, but it also became a crucible of healing. On muddy floors, under dim lamps, in tents rocked by shell fire, in trains rattling across continents, medicine reinvented itself. Doctors learned new techniques. Nurses carried impossible burdens. Scientists developed tools that would save future generations. Wounded men fought not only to survive, but to reclaim their dignity. In a world consumed by destruction, the act of healing became a quiet form of heroism. The Great War reshaped medicine, and medicine, in turn, reshaped humanity's ability to face suffering with knowledge, compassion, and determination. The battlefields have long grown silent, but the advancements born from their agony continue to save lives every day.